Today we are going to do 4.16 to 4.20 Yoga for Prevention and Management of Lifestyle Disorders. Now we come to the 4.16. What is the concept of yogic lifestyle?
Milan sir, 1 minute. 4.18 is taken by Shachiratna ji. So you just 4.18.
1 minute.
Shachiratna ji is taking the topic. So you can skip it. You can take remaining.
4.18 who is taking?
Shachiratna ji is taking.
Who is that?
Shachiratna ji is taking the topic.
Yeah, but it is combined, so this cannot be isolated. They can
You
can revise also.
Okay, sir. Okay, sir.
So each are interlinked, sir.
Okay, sir. Done.
And I have taken in details in 4.18. Okay. Disorders.
Okay, sir. Okay. Okay, sir. Continue, sir.
So that is where revision for them. Okay.
Okay.
Now yoga brings together physical and mental disciplines to achieve a peaceful state, body of mind. Yoga helps to manage the stress and anxiety and keeps you relaxing. You know all these definitions of yoga. Yoga also helps in increasing the flexibility, muscle strength, and body tone. Yoga improves the respiration, energy, and vitality. Yogasanas build the strength, flexibility, and confidence. This is just a recap of what you have studied. The importance of yoga in modern life is abundant. Yoga teaches us the knowledge of how to lead a healthy living. It improves our concentration, creativity, and sharpens our memory. So another importance of yoga in modern life can be that yoga improves our muscle strength, stamina, and bring immune and mental stability. Yoga is essentially a spiritual discipline based on extremely subtle science, which focuses on bringing harmony between mind and body. It is an art and science of healthy living. The word yoga is derived from the Sanskrit word used meaning to join or to yoke or to unite. Now we come to the 4.16. Through the due regularity of yoga, we can prevent from various diseases fighting resistance, enhancing the flexibility. If we do yoga asanas daily, so we can enhance our flexibility, which are very important for leading a healthy life. It prevents us from injuries and sports and body movement. 1 minute. संवादाला बेटा संवादाला झूम मध्ये एक डॉक्टर आहे, आपले योगा डॉक्टर आहे, ते आपल्या योगा मुद्राबद्दल तुम्हाला सांगतील. ओके, तुमचं बॅकग्राऊंड तुमचं पाहिजे तुम्हाला बॅकग्राऊंड. ओके. Yoga improves the strength, the balance, and flexibility. Yoga relieves back pain relief, arthritis symptoms, can ease the benefits the heart health. Yoga relaxes you to help you sleep better. Yoga can mean more energy and brighter moods. Yoga helps you to manage the stress. And yoga connection support the community. नंतर फोन करतो. मी नंतर फोन करतो मॅडम प्लीज. नंतर क्लास चालू आहे माझा, फोन करतो नंतर. Concept of yogic life and its relevance. Health benefits of yoga are increase of flexibility, which helps you to build a strength, improves your posture, helps to keep your joints healthy. It's a powerful mindfulness practice. Yoga reduces the stress, lowers the blood pressure, helps you to make healthier life choices. Yoga improves the breathing mainly on the respiratory system. Yoga encourages your body's natural healing process. Now we come to 4 point yoga. Yoga versus the concept of origin and disease. Okay. Now see the yoga concept, yoga versus how it defines Adi. 1 minute, sir. 1 minute, please. As per yoga sister, any mental application, mental agitation takes place which have the haphazard flow of the prana and instability of the nadis. Then we come to the from the flow of the prana we come ajirtottam and atijirtottam. Okay. From instability of nadis we come pujanivartam, wrong digestion. Here old digestion ajivartam and ajirtottam is under digestion. This leads to physical ailments that is known as vyadhi. So from mental afflictions, it leads to the physical ailments. So the in short, on the Panchakoshas, it travels from the Manomaya Kosha to Pranamaya Kosha, and from Pranamaya Kosha, it enters into the Annamaya Kosha. Okay. It's generated by, so physical ailments are generated by the Adis, mental affliction, and not due to Adis is Anajivan. That is not due to mental afflictions. Okay. Due to mental affliction, which are the essential types are SAR and Samantha, responsible for the cycle of birth and death of the physical body. That is the SAR. And Samanya is psychosomatic elements caused during the interaction with the world. Okay. And not due to the Adis is Anadi. Okay. Next. Yoga Vasishtha 2/32 states समक्षोपत्यंश मृत्युजः वहन्ति प्राणवायाः देहे गज प्रविष्टेन पयन्सिवः सरितेत्तः. Because of agitation, pranavayu will abandon the state of equilibrium and flow erratically in the body, just as the turbulent waters of the lake when the elephant enters it. Asme vahati prane nadyu anti visapistya asai Asayinkaskito Bhupe Yata Varna Samaktaram. Because of the uneven flow of prana, the nadis become unsettled, just as are brought into the societal system when the king is inept. Vasishtha affirms that turbulence at a Manomaya Kosha gives rise to turbulence in the energy level. The erratic behavior of the prana implies the abnormal functioning of the physiological system, which subsequently leads to the body disease. Awareness, and now we come to the disease type, which are the acidity. Acidity is also known as acid reflux. It can be caused with the eating food which is excessively oily, salty, spicy, or sweet. Excessive intake of caffeine, tobacco, and alcohol can further worsen the problem. Another possible cause of the spike in the acidity can be going to sleep immediately after eating the food. All these habits with the added stress of daily life are what cause and aggravate the acidity. The common asanas recommended are Vajrasana, Pawan Muktasana, Nadi Shuddhi Pranayama, and Kapalbhati and Ustrasana. The common asanas recommended are Vajrasana, Pawan Muktasana, Nadi Shuddhi Pranayama, and Kapalbhati and Ustrasana. But yoga is a great way to cure the gastric acidity problems when combined with some simple lifestyle changes and healthy eating. One can see greater results in their overall gastric health. Include more fruits and raw vegetables in your diet. Reduce the consumption of oily and spicy foods. Avoid eating sweets. Avoid having meals right before the bedtime. Reduce the intake of the caffeine. Refrain from tobacco and alcohol consumption can help you alleviate the acidity. Increase the consumption of water and other liquids like buttermilk and coconut water. Yoga practices help to develop the body and the mind, bring a lot of health benefit, yet it is not a substitute for medicine. Then after acidity, we go to constipation. Constipation not just means no or little bowel movement, it rather makes its presence felt through a range of symptoms, including infrequent or few bowel movement, straining while having a bowel movement, passage of hard or small stool, stomachache and cramps, abdominal pain, bloated stomach, and headaches. Okay. The root cause of this polar syndrome is unhealthy lifestyle, attributes of which includes inappropriate work hours, less time for rest, intake of too much of junk food, a diet low on fresh fruits and green leafy vegetables, less intake of water. You are very well aware that modern society, you can see the IT boys struggling their life, they're getting lakhs and lakhs of rupees, but then their health get deteriorated very fast due to the in a inappropriate lifestyle. That is late sleeping, late food, junk foods, just calling from the coming from the office late hours, not getting the sleep properly. Too much of stress also causes this all these imbalances. Yoga helps to energize our body and increases the flow of the blood and oxygen in the system. Since most of the yogic practices, postures involve pelvic movement, yogic practice can really help in relieving the constipation most. The five major postures recommended are Mayurasana, Ardha Matsyendrasana, Halasana, plow posture, Pawan Muktasana, wind relieving pose, and Baddha Konasana, butterfly pose. Then we come IBS, Irritable Bowel Syndrome. You know this is a picture of a intestine, a small intestine, large intestine. Is defined. How you will define IBS? Irritable bowel is the abdominal pain or discomfort that occurs in association with altered bowel habits over a period of at least 3 months in the absence of any detectable organic cause. It took me 3 days to complete this PPT. 3 days. Number of hours I spent are nearly 4 to 5 hours daily. With great thinking, I put this all this into this item 4.16 to 4.20. The detailed explanation is there. Then we come to the next IBS. What are the causes and symptoms you should know? First cause is same one. Abdominal pain or discomfort that occurs in association with altered bowel habits over a period of at least 3 months in the absence of any detectable organic cause. Second, it can be classified as either diarrhea predominant, constipation predominant, or IBS with alternating stool pattern. Okay. IBS is not the prevalent functional gastrointestinal disorder in the world. It's the most prevalent functional gastrointestinal disorder in the world. We call it as IBS or we call it GI disorder also. Symptoms: IBS is a group of symptoms manifesting as a functional gastrointestinal disorder in which patients experience the abdominal pain, discomfort, and bloating that is often delayed with defecation. IBS is often associated with a host of secondary comorbidities such as anxiety, depression, headaches, and fatigue. These are all nervous system related problems which are caused due to this much. You are all aware this is DISEASC. That means the functions of the organs are not functioning to the desired level, and that may lead into unmanifested systems of working. Okay, the system is not working to the desired level. In this review, we examine the basic principles of Panchakosha, 5 sheets of human existence, from an Indian sculpture, Taittiriya Upanishad, and the pathophysiology of a disease from the yoga approach. Yoga versus Adi originated from the mind and Vyadi, ailment, disease concept. An analogy between the age-old, the most profound concept of Adita Vyadi, and modern scientific stress-induced dysregulation of brain gut axis as it relates to IBS that could pay for impacting IBS is emphasized. Based on this perspective, a plausible yoga module as a remedial therapy is provided to better manage the primary and secondary symptoms of IBS. Basic asanas, Shriti Kriyas, and pranayama for IBS. See, apart from the disorder, when you learn the YCB therapy level, you have to go very deep into it. Not only the causes and the symptoms, but various other reasons attributed for the causes. Okay, what are the medical treatment for it, and what is the yogic approach to it? Okay, so that point has to be studied. The disorders when we study any disorders. Okay, basic asanas are yoga practice are considered much useful for IBS. The basic asanas are the preventive measures for IBS is as follows: asanas. Standing sitting and this Ardhakati Chakrasana, half wheel, Ardha Chakrasana, half wheel pose, Padahastasana, hand to feet pose. Trikonasana, triangle pose. Parivarti Trikonasana, revolved triangle pose. Vrikshasana, tree pose. Basic asana, Vakrasana, half spin twist. Paschimottanasana, seated forward bend pose. Bhujangasana, cobra pose. Salavasana, locust pose. Sarvangasana, shoulder stand. Viparita Karni, Matsyasana, Chavasana. Basic kriyas for IBS is clenching the ability to Kapalbhati, forceful exhalation, Uddiyana and Agnisar, abdominal lock and rigorous movement of the abdomen, Vibhagya Shavasana, sectional breathing, Chin Mudra, Chinmay Mudra, Adi Mudra, and Brahma Mudra, Nadi Shuddhi Pranayama, alternate nostril breathing, Shitali cooling Pranayama. Okay. Awareness of bronchial asthma. Asthma is a chronic disease involving the airways in the lungs. These airways or the bronchial tubes allow the air to come in and out of the lungs. If you have asthma, your airways are always inflamed. They become even more swollen and the muscles around the airways can tighten when something triggers your symptom. You can see the person you are taking here is the, so without that, his functioning level of the respiratory system will not be proper. That means there is a dilation in the bronchial tubes. The flow of the air, the oxygenated air inside the lungs is not proper. Thereby, the diffusion of gases doesn't take place. So, in an asthmatic person, when the normal level of functioning is to the extent of 40%, in an asthmatic person, it is only 10% or 15% of the lungs, which has been proved by research beyond doubt. Okay, bronchitis is still worse. Bronchitis is still worse than asthma. Asthma is a condition in which your airways narrow and swell and may produce the extra mucus. This can make the breathing difficult and triggers a coughing, a whistling sound when you breathe out, and shortness of breath. The three types of asthma are nocturnal asthma. This is the most common type of asthma. Exercise-induced asthma or exercise-induced bronchoconstriction. Physical exertion of patient during an exercise can trigger asthma in some cases. Allergic asthma or seasonal asthma. Inhaling physical exercise during an exercise can trigger the asthma in some cases. Allergic asthma, seasonal asthma, inhaling allergens is the most common trigger for inducing the allergic asthma. The list of new pranayama and yogic posture to help the counter asthma more effective. Nadi Siddhi pranayama, Kapalbhati pranayama, Ardha Matsyendrasana, Pawan Muktasan, Sedubandhasan, Bhujangasana, Adho Mukha Svanasana, Baddha Konasana, Purvottanasana, and Shavasana. Following 8 tips can improve the lung health: diaphragmatic breathing, simple deep breathing, counting your breaths, watching your posture, staying hydrated, laughing, staying active, and joining a breathing club or a laughing club, whereby the breathing capacity increases. So we will put it in the other way, that instead of doing the asanas first and pranayama secondary, here the pranayama is even more important because of the lungs. When the bronchial tubes has been dilated and there are more constriction. So first of all, you have to clear the process of the respiratory tract. See that the breathing is proper, and then only the asanas will become better and better. So in all this PCOD, pulmonary obstructive disease, then bronchitis and asthma or other respiratory disorders, first function is towards a pranayama and other level. Okay, then only you can go to the next asanas or better asanas. Okay, then you come to sinusitis. Everybody knows Kapalbhati is very famous for sinusitis. It's a common condition defined as the inflammation of the paranasal sinuses. Sinus cavity is produced the mucus that nasal passages need to work effectively. Sinusitis can be acute or chronic. Causes of sinus inflammation includes viruses, bacteria, fungi, allergies, and an autoimmune reaction. Sinusitis is usually caused by virus and often persists even after the other upper respiratory symptoms are gone. In some cases, bacteria or rarely fungus may cause a sinus infection. Other conditions such as allergies, nasal polyps, and tooth infection can also contribute to sinus pain and symptoms. Most sinus infections are viral and only a small portion of develops a secondary bacterial infection. Rhinoviruses, influenza viruses, and parainfluenza viruses are the most common causes of sinusitis. What are the causes of sinusitis? Chronic sinusitis can be caused by an infection growth in the sinuses, swelling of the lining of the sinuses. Signs and symptoms may include nasal obstruction or congestion that causes the difficulty breathing through your nose and pain and swelling around your eyes, cheeks, or forehead. You can see the bifurcation here of the different parts of the sinus cavities. Okay. See here in the frontal sinus, then is ethmoid sinus, then you have the sphenoid sinus and the maxillary sinus, different parts. What are yogi puja? Yogi kriya jalniti, kapalbhati, kapal brandra dauti, asanasar, sarvangasan, bhujangasan, ushtrasan, konasan, chakrasan. Pranayama, anulom vilom, basrika, sorry, Suryapan pranayama and shavasana. Next we got to hypertension. What is hypertension? You know diastolic and systolic pressure. Okay. Normal hypertension is to the extent of 120 on the upper level and 80 on the lower level. Any reading above 140 to 150 is a sign of hypertension. Is a sign of higher level of BP. Physiological stress management, circadian synchrony, body weight management, healthy dietary pattern, regular physical exercise, regular sleep-wake cycle, reduction in body weight in the people with obesity, diet with low sodium potassium intake, with lot of fruits and fibers, endurance and resistance training, meditation and relaxation technique. Okay. Now, what are definition and diagnosis of one of the most common health disorder prevalent today is hypertension or high blood pressure. This occurs when the pressure inside the blood vessels is higher than the normal expected values for age and gender. Yoga, when adopted as a way of life, has a lot to offer for those suffering from the stress-induced psychosomatic lifestyle that is a silent killer. Hypertension should be diagnosed only after taking several readings. The blood pressure needs to be taken at least 2 times, and each reading must be from a different day. If the average of this blood pressure is more than 140 to 190, hypertension can be diagnosed. A single reading that is more than 140 does not necessarily confirm it, but requires further monitoring. Okay. Definitely, when you can advise your patients also when they go to the read the BP to a general practitioner at the clinic. Go relax, have the water, read something, see that you are not very urgent to your office or urgent to your domestic work at home, but see that you are completely relaxed and then take the reading. The reading will be proper. Otherwise, if you go in a very hurriedly or haphazardly way, the reading which you derive will not be proper. Okay, and here what is said, you have to take an average reading of 2 to 3 readings. So that reading will be much perfect at a different interval, say of 2 hours or 3 hours. The initial strategy in managing should be always include dynamic advocacy of lifestyle modifications. However, in patients with BPs on the higher side, medications will need to be taken along with the lifestyle modifications until their condition stabilizes. The aim should be to lower the blood pressure as close to the normal range as possible. Many therapists seem to forget that lifestyle changes are the first step in hypertension treatment. These changes can also improve the quality of the patient's life as well. General precautions: lose weight, restrict the alcohol intake, increase the physical activity like walking, etc. Reduce the sodium intake to less than 100 ml. Maintain the adequate dietary intake of calcium, potassium, and magnesium. Stop smoking and reduce the intake of saturated fats and cholesterol. Yogi poses involves breathing in a certain pattern which can control the blood pressure as well as relieve the stress. It will also enhance the functioning of your heart Yoga leaves a positive impact on your mind and body. It can effectively aid to lower the blood pressure. Here are some of the effective yoga asanas for hypertension. Balasana, the child pose. This asana reduces the stress and improves the blood circulation throughout the body. Controlled breathing while performing this asana promotes calmness and reduces the stress from the neck and shoulders. Cardio exercises are best for your health as they enhance the flow of the blood. This exercise also burns a huge amount of calories and promote a healthy heart. One minute. Household chores, climbing the staircase, stretching exercises. These are some of the other factors which will simple exercises for hypertension. Walking is a must. Walking is a good habit for hypertension or any type of disease for that matter. Sukhasana, proper yoga asana which regulates the breathing. This pose gives you relief from the high blood pressure by promoting a peaceful mind, and a relaxed mind promotes a healthy body. Shavasana or the calf pose is totally meant for relaxation. This is one of the easiest poses which you can try to control your blood pressure. Shavasana calms your brain, relieves the stress, relaxes the body, reduces the headache, fatigue, and insomnia. Cobra pose or Bhujangasana pose. Cobra pose, also known as Bhujangasana, is helpful in circulating the blood and oxygen. This pose also relieves the stress and promotes the heart and health. Bridge posture also regulates the blood pressure. It calms the brain and alleviates the stress. This asana is also beneficial in managing the mild depression. Kapalbhati, Anulom Vilom, Brahmari, full yogic breathing, or the guided meditation as per the standard norms, Yoga Nidra. Neck pain, the symptoms and the causes. I think we'll take up tomorrow because there are a lot of other items to be added for this. Neck pain, we have then low back pain, osteoarthritis, then role of yoga in prevention management of common disease, acidity, constipation. This all will take tomorrow with your kind permission. Because of my heavy work, I'm little tired today. Any difficulty up till now, please?